Well, hi there. My name is Dr. Andrew Grecki. I'm the owner of Superior Physical Therapy. And in this video, you're going to learn how to avoid the three most common mistakes that people who are dealing with pain make that oftentimes delays the healing process and can actually make things worse. You're also going to discover how to get a free exam with me. But first, let me share with you three super simple concepts that are going to help you get rid of pain once and for all. So, the single biggest mistake that I see people in pain make is that they're hoping it's just going to go away on its own without doing something about it or getting help from an expert. I would call this ignoring it. I don't know about you, but I can't think of many problems that just go away on their own by just ignoring it. Of course, unless, of course, you're a politician. Now, ignoring it doesn't mean that you aren't thinking about it or talking to your spouse about it, or maybe even you've talked to your doctor about it, but you simply haven't done anything about it to try to fix it and make it go away. Besides maybe avoiding the activities that hurt, which of course is another way of ignoring it. We all have to agree that ignoring problems, especially pain, isn't going to do the trick. In fact, as a pain specialist, I know that most pain that increases when we move falls into the category of accumulative trauma disorder. You might be familiar with the term overuse injury, which simply means that the thing that's causing the trauma or the stress in the area that makes it hurt is actually growing over time. So by nature of the name, it's only going to get worse the longer that you ignore it. Now, another really common mistake that people make when they're dealing with pain is that they most of the things they've tried to fix the problem are only band-aids. And what I mean by that is they don't fix the problem, but they only mask the symptoms. Now, this is typically not their fault, but it's what they've been given from the medical system. So let me explain. A few examples, and there are many examples of treatments that only mask the symptoms, but mainly the most common will be medications. And there's really two types of pain, or two types of medications that I see. They fall in the category of either pain medications or anti-inflammatories. So first, let's talk about pain medications. They only change our brain's perception of the pain. They don't make the thing that's causing the pain go away. And secondly, anti-inflammatories, they only suppress our body's inflammation response to the injury. And this actually delays the healing process, as inflammation is a natural and normal part of healing. Another super common band-aid would be injections. We see injections are commonly done along the nerve in order to decrease inflammation. Again, this only suppresses our body's response to tissue damage or injury. It doesn't fix anything. And finally, the list of other things that are band-aids are too large to cover, but let's just list a few. So they usually come in the form of fancy machines like ultrasounds or lasers or electrical stimulation devices, hot packs, cold packs, hang upside down machines, creams, ointments, braces. The list is huge. Ultimately, this doesn't provide a healing opportunity. It only masks the symptoms of pain, which can eventually, and usually does, make things worse. And finally, the third most common mistake that people who are struggling with pain make is that they don't know what their problem actually is. They get fooled by the diagnosis, which usually comes from an image, like an x-ray or an MRI. You see, the image or the diagnosis explains the changes that have taken place inside the body, but it doesn't explain the reasons why you're having pain. Musculoskeletal pain is increased or decreased with certain movements. Each movement has their own, each person has their own movements that make them feel worse or better. And the body does not move in an isolated fashion. It moves together. So in order to get the painful area to feel less stressed out, the areas above and below that painful area must move as they were designed to move. And in almost all cases, movement-related pain, the source of the problem is in the areas above and below. And I've even had a personal experience with this exact same situation. You see, back in 2004, when I was struggling with back pain and sciatica for over 18 months, I spent over $100,000 on treatments, and all of them were focused on my back itself. Medications, injections, massage therapy, chiropractic, physical therapy, and even surgery. All of these treatments failed. It wasn't until I discovered that my hip no longer was rotating like it should. I was able to relieve my back pain once and for all, and it only took 3 weeks of treatment. So this is the very same method which I've used on over 10,000 patients in the past 10 years, and I want you to experience that as well. That's why I'm offering you today the opportunity to come in for a completely free consultation or exam. And in this exam, we're going to look at really three really common areas that people have mobility issues: the hips, the foot and ankle, and the upper spine. 80% of problems that I see are a result of those three areas not moving properly. So in this free consultation, we're going to do three simple things. Number one, we're going to determine if I can help find pain relief for you. We don't want you to waste your time and money if it's not going to work, right? Number two, we're going to figure out what your problem really is. So I can tell you it's not the area that hurts that's causing the pain. It's the areas above and below. So we're going to look at those areas to determine whether or not those areas are a problem. And then finally, number three, we're going to discuss the solutions that are available for you to fix your problem naturally. And I've also got something special that comes with this free consultation. Let's call it a bonus. I'll write it down for you so you can remember. I call it the treatment plan. This way you can keep it, put it on the fridge, bring it to your doctor, whatever you want to do with it, but it gives you kind of a peace of mind and hope and direction, and it also helps you remember what we talked about. So this is an incredible deal, but this deal does expire. It expires 3 days after you watch this video. So you might want to pick up the phone right now and give me a call to set up your free exam. There's going to be no late addition, so you really need to go ahead and take advantage of this amazing deal, and you simply have to call me at Superior Physical Therapy, 231-944-6541, and we will set up a completely free exam to get you on the path of natural healing. Thanks for listening, and I hope I see you soon.